Otitis externa is one of the most common problems encountered in dogs. Most acute cases can be managed with empirical ear drops, but frequently these cases will recur and evolve into a more chronic problem that is much more difficult to resolve. Furthermore, recurrent otitis is a common source of pet owner dissatisfaction and often results in a second opinion being sought. Ongoing cycles of infection and inflammation ultimately lead to irreversible change within the ear canal and may select for antimicrobial resistance, which can make treatment extremely challenging. Diagnosis and management of the underlying triggers for the otitis is crucial, but long-term remission of recurrent otitis relies on managing the inflammation in the ear canals to prevent flares. Making sure that pet owners understand this is critical. Choosing appropriate products and demonstrating how to apply them are also important in ensuring good compliance and a successful outcome. Goals of treatment for otitis externa. Number 1. Identify and manage the primary cause, the most common of which is allergy in young, otherwise healthy dogs. Number 2. Correct predisposing factors if possible. Number 3. Remove debris and discharge. Number 4. Manage the secondary infection. And finally, number 5. Reverse chronic pathological change. Bacteriology allows fairly precise identification of the species of bacteria present and its susceptibility to a range of antimicrobials chosen by the specific laboratory to be suitable. The breakpoints at which organisms are determined to be either susceptible or resistant to antimicrobials are determined based on the use of oral and other forms of systemic antimicrobials. However, when we use antimicrobials topically, we often achieve times 100 to times 1,000 the concentration at the site of infection, which in most cases will overcome any potential resistance in vitro. Therefore, culture and sensitivity results should be used only as a guide. Bacterial culture and sensitivity testing is not necessary in most cases of otitis externa and where topical therapy is being used. Cytology, however, can effectively identify the most likely organisms present in most cases of otitis and provide an idea of the degree and severity of infection. Cytology, along with clinical response, is also the best way to monitor treatment success. Malassezia yeasts and staphylococci are easily identified by cytology, and their likely sensitivity can be estimated from a knowledge of local resistance patterns and previous treatments. Rod-shaped bacteria, however, are harder to differentiate on cytology and have a more unpredictable sensitivity profile and can readily develop multi-drug resistance over time. So when is culture and sensitivity testing indicated? When rod-shaped bacteria are found on cytology, when there has been a previous poor response to empirical therapy, when there is a history of exposure to a possible source of resistant bacteria, for example methicillin-resistant Staphylococcus species, such as a known affected animal or human in close contact, when topical treatment is not possible, and/or if systemic treatment is indicated, for example in otitis media. Ear cleaning. Ear cleaning is an important component of managing otitis externa. It has the following benefits. Number 1, it facilitates visualization of the ear canal and the tympanic membrane. Number 2, it allows removal of wax and debris and microbes, as well as small foreign bodies. Number 3, it allows better penetration of topical products and therefore improved efficacy. Ear cleaning can be undertaken in clinic or at home using a proprietary ear cleaner. Sometimes it is necessary to perform a deep, thorough ear flush in the hospital under general anaesthesia, for example in a case of Pseudomonas otitis. What properties should an ear cleaner contain? pH neutral, gentle and soothing, antiseptic, antibacterial and antifungal activity, drying because most infections are due to increase in humidity, ceruminolitics, wax dissolving properties, and other properties such as surfactants, foaming agents to aid cleaning. Properties of epiotic. This has a neutral pH, is alcohol and fragrance free, it has antibacterial properties, contains PCMX, EDTA, and defensins which stimulate synthesis of antimicrobial peptides part of the skin's innate defence. And glycotechnology, which prevents adherence of bacteria and surface proliferation of microbes. Cleansing properties, salicylic acid and surfactants, which help remove wax and debris. How should an ear cleaner be used? Typically, the ear should be cleaned 2 to 3 times weekly when treating a case of otitis externa. This can be reduced to weekly when infection has resolved, and in some cases should be maintained in the long term to prevent recurrence of infection. The ear canal is an L-shaped tube lined by skin. It acts as a funnel to direct liquids from the opening of the ear canal down to the tympanic membrane or eardrum. The principle of ear cleaning involves filling the ear canal with the cleaner, massaging gently for at least 30 seconds, gently wiping away any excess cleaner, and finally allowing the dog to shake its head, and of course providing a reward afterwards. What should an ear treatment contain? Most proprietary ear treatments contain a combination of 3 active ingredients. These are known as polypharmacy drops. Antibiotic targets the bacterial component of the infection, antifungal targets the fungal and yeast component of the infection, and anti-inflammatory reduces pain, pruritus, inflammation, and exudation. This combination of active ingredients aims to treat the secondary infection, address the inflammation associated with the underlying cause, and normalise canal lumen and function. Choice of product should be based on cytology findings, owner compliance, ability to treat, and consideration of antibiotic stewardship.